Hello everyone, my name is Juliati and I am a community pharmacist working with Watsons. Once again, welcome to Watsons Facebook Live, Ask Our Pharmacist. On a previous Facebook Live video, I shared on a topic on an eye care and some tips on how to care for your eyes. If you missed that video, feel free to go to Watson Facebook page. Under the video tab, you'll be able to see all our past Facebook video live there. For today's Facebook segment, I'll be discussing one of the most common skin condition known as skin contact allergies. I'll be sharing with you guys about what is skin contact allergies and or medically known as contact dermatitis. What are the different types of the skin contact allergies or contact dermatitis? And what are the ways that you can do to manage the conditions? And lastly, how are they different from other common type of a skin conditions such as eczema and fungal infections? If you have any questions along the way, feel free to leave them as comments and I will try my best to answer them. Skin contact allergies or contact dermatitis is an itchy skin rash that is caused by a direct contact between an irritant or allergens with our skin. The skin, apart from appear to be red and itchy, it can also sometimes develop swelling and blisters. Although it is not contagious and rarely life-threatening, but it can be uncomfortable, especially if the cause cannot be identified. In general, there are two types of contact dermatitis. The first one, being the most common one, is the irritant contact dermatitis. Irritant contact dermatitis is a condition whereby there's a high concentration of a strong irritant, such as acids, harsh soaps, bleach, and detergents that damage the surface of the skin that faster than our skin can repair. So these high concentrations of strong irritant actually damage the outermost surface of our skin. Although in some cases, irritant contact dermatitis may happen with a milder irritants such as even milder soaps and water. This is especially quite common in people whose occupations are hairdressers, healthcare professionals, and domestic workers whose hands are always in contact with water. As the rash is caused by an irritant, you will expect the area of affected area is confined to the area of exposure, and the severity is highly dependent on the strength of the irritant, the frequency of the exposure, as well as the skin susceptibility. The second type of contact dermatitis actually is also known as an allergic contact dermatitis. Unlike the first one that I mentioned, which is the irritant type, allergic contact dermatitis only occurs to certain individuals who are allergic to a certain substance, which is usually harmless to majority of people. So in these certain individuals, this substance actually cause an immune reactions when they come into contact with the substance. We usually term this substance as allergens. So example of the common allergens are nickels, that is usually on the bracelets, on a watch, and perfumes, preservative, as well as some antibiotic creams and even ointments. As the skin the skin reaction that involve immune system in a process, sometimes the rest may take several days for it to develop after in contact with the allergens. And in a case of an allergic contact dermatitis, even a small tiny bit of an allergen is sufficient enough to trigger a skin reaction. Although contact dermatitis is usually not life-threatening, do consult a doctor promptly if you notice that the rash affect the genital area or majority of your skin, affect your sleep or daily activities, accompanied with fever, or it looks infected with the pus that oozing out from the blisters, and it does not even get better after you self-treat the rash for about 1 to 2 weeks. Sometimes it is not easy to distinguish whether a rash is caused by an irritant or allergens, because the substance that is in focus could be both an irritant at a higher concentration, and yet it can be also an allergen to some people. Nevertheless, the treatment for both the irritant as well as the allergic contact dermatitis are pretty much the same. Of course, the best way to treat a contact dermatitis would be to stay away completely from the causative irritant and allergens. However, if that's not possible, what you can do is first you can wash your skin immediately after you come into contact with the irritant and allergens to ensure a thorough removal of the irritant. You can also apply cold pads on the affected area several times a day to soothe the skin. You should also moisturize the skin frequently, as dryness can actually worsen the symptoms of the rash, such as dryness and itchiness. It is best to apply moisturizer right after the bathing so that it can help to lock in the moisture. If possible, you should also try to wear some protective gears whenever possible. For example, you can choose to wear a glove when handling household detergents, or you can apply barrier creams to an area whereby the contact with the substance is inevitable. For example, you can use a barrier cream on a babies who are wearing diapers. Apart from avoiding the causative agents as well as reducing their exposure, there are also some medications that are available that you can use to try and manage the condition. The first one is topical corticosteroids cream. Topical corticosteroids can be bought from a pharmacy and usually come in different type of strength. It can actually help to soothe the redness, itchiness, and dryness from the skin rash. It is usually to be applied on an uninfected and unbroken skin once to twice daily for 1 to 2 weeks. Do consult your pharmacies, retail pharmacies, for options of a topical corticosteroid cream. And if the itch become intense, or the rest actually affect majority of the body, you can consider taking an oral antihistamine. We have some over-the-counter antihistamines such as loratadine, cetirizine, and fexofenadine. They are all convenient in administration, which is a once daily dosing, and they are non-drowsy, which is definitely suitable for people who needs to stay alert during the day. In a more severe cases, you may notice that the doctor may even have to prescribe an oral corticosteroid pills or an oral antibiotic pills when the swelling is extensive or when a bacterial infection is present. So it bring us to the last section of today's discussion, which is how do we even differentiate them between contact dermatitis versus eczema versus fungal infection. Eczema, or medically known as atopic dermatitis, is a red, itchy, and inflammatory skin disease that can be seen in both children and adults. It is usually caused by a combination of factors such as genetics, environmental, as well as immunological. Whereas in contact dermatitis, they should have a direct contact between the skin and the irritant or allergens. And usually in contact dermatitis, there's an absence of a family history. Eczema is commonly associated with other type of allergic condition such as asthma, as well as allergic rhinitis. The second type of another common skin condition would be the superficial fungal infections. Superficial fungal infections, as its name suggests, is caused by fungus such as yeast. They can affect your skin, your hair, and your nail. So, for in the skin, fungal infections may appear as a red, circular, and scaly patches that is very itchy in an area whereby the sweat tends to accumulate, such as your underarm, your skin folds, and your groin area. Environmental factors such as excessive sweating, high humidity, and damp condition actually contribute greatly to the development of the superficial fungal infections. In this management of the fungal infection, the use of an antifungal cream is necessary to remove the fungus. To sum up, different type of skin conditions may appear to be somewhat uh, similar to another type of a skin condition, which is the symptoms such as a red, itchy, and skin kind of rash. Therefore, to avoid delay treatment, it is best to seek a professional help early whenever you develop any of the common symptoms. Alright, so we have come to the end of today's sharing. I will look at some of the comments and I'll try to answer the questions to the best that I possibly can. Okay, let me see the questions. Alright. Okay. Okay. Seems like we don't really have any questions that I can see yet on the comment section, but not to worry. You can always leave them as in the comment sections, and I will be around until 5 today to answer your queries. Thank you very much, everyone, for listening in today. And I hope that today's sharing, you actually have learned something and know slightly a little bit about contact dermatitis, eczema, and fungal infections. So have a nice day, everyone, and stay safe.